I should like to start by expressing my profound gratitude to the organizers of this conference. I am particularly encouraged to see survivors of Noma sharing their experiences as part of the event. Centering their voices is crucial in any endeavor aimed at preventing and treating Noma. The project Noma, the Neglected Disease, an interdisciplinary exploration of its realities, burden, and framing, about which I will be talking today, equally seeks to achieve such a centering of those affected by Noma. My name is Dr. Ioana Cismas. I am an international and human rights law scholar based at the Center for Applied Human Rights and the York Law School in the UK. My research on Noma started in 2009 when I joined the team of legal advisors of Jean Ziegler, a member of the advisory committee of the UN Human Rights Council. In that capacity, I drafted a number of studies on discrimination in the context of the right to food, as well as on Noma for the advisory committee. Today, I'm conducting practice-oriented interdisciplinary research on Noma, together with dear colleagues at the Institute of Global Health at the University of Geneva and the Swiss Tropical and Public Health Institute in Basel. Our research would not be possible without close partnerships and collaborations with non-governmental organizations, intergovernmental organizations, and governmental bodies. And this includes the Fondation Sentinelle, Health Frontiers Laos, Hilfsaktion Noma, Médecins Sans Frontières, Songe, Winds of Hope Foundation and the International NoNoma Federation, the World Health Organization, relevant governmental bodies in Burkina Faso and Niger, and a number of academic partners. We benefit from conceptual, methodological, and operational input and support. And we hope that through such collaborations, we will be successful in achieving our project's overarching aim. And this aim is to generate academic and social impact at local, national, and international levels by providing a better understanding of Noma and engendering action to prevent, detect, and treat this disease and to redress the associated human rights concerns. Specifically, our research seeks to provide empirical as well as conceptual data to support efforts for the inclusion of Noma in the World Health Organization list of neglected tropical diseases. Our research focuses on three major pillars. And I should say that we are 1 year in the project. So what I will be presenting today will be some preliminary findings, while also presenting some of the forthcoming work that we have planned. So first, what we seek to do in the project is to further clarify Noma's epidemiology and its global burden. The data that we have now on Noma's epidemiology paints a bleak picture. 140,000 children are estimated to be affected yearly by Noma, and there are 770,000 Noma survivors worldwide. This is data produced by the WHO dating to 1998. Whilst many of those affected by Noma are in sub-Saharan Africa, Noma is not confined to this region. My colleague Leila Sroor concludes that it is likely that Noma is much more frequent in remote Asian rural communities than is currently appreciated. This disease is highly deadly. Its mortality and morbidity rates are far greater than those of many other diseases that are formally included in the WHO list of neglected tropical diseases. However, at the moment, we lack an accurate estimation of Noma's global burden. As such, a cause of substantial human health and life loss may be largely neglected and unaddressed, or indeed is largely neglected and unaddressed. And it is at this juncture where the outputs of our project become important. Colleagues at the Swiss Tropical and Public Health Institute in Basel, involved in this project, have been conducting a systematic literature review, searching 11 databases, screening titles and abstracts and full text. This systematic literature review, which will be finalized in spring 2021, will be refined based on results from a complementary epidemiological analysis of existing patient records, which will also be finalized this year, as well as household cross-sectional studies in Burkina Faso and Niger, which we aim to undertake later this year. Building on these results, disease models will be established, parameterized, and quantitatively analyzed in order to estimate the global burden of Noma in disability-adjusted life years, or DALYs, by using the methodology, definitions, and specifications of the global burden of disease collaboration. By mid-2021, we hope to be able to share up-to-date epidemiological data on Noma and a global burden estimate, which should then in turn assist advocacy efforts for the inclusion of Noma in the WHO list of neglected tropical diseases. The Noma project's second research pillar focuses on the lived realities of children at risk and children and adult survivors of Noma worldwide, including in Asia. And we focus on two specific aspects: the risk factors, social determinants, and socioeconomic costs of the disease, as well as the realization of survivors' human rights. Certainly, to prevent and treat the disease, we need to understand what causes it and how it manifests itself. However, there is another imperative for focusing on the lived experiences of children and adults at risk of and with Noma. This is, in my view, at the very least, a moral responsibility, if not legal, that stakeholders have to listen attentively to the voices of those individuals who are affected by this disease. In our efforts to address Noma, we must be guided by their experiences and seek to center their voices and their actions. And in this respect, I'm particularly encouraged by the step-by-step guide to develop national action plans for Noma prevention and control in priority countries. This is a document that has been recently produced by the WHO's Regional Office for Africa. And this guide specifically recommends that, and I'm citing, survivors of Noma and their families should be involved in drafting national Noma control program action plans. And the rationale for this is because such an approach would ensure the participation of those most affected by the disease and be informed directly by their experiences. One of the methods that my colleagues from the Institute of Global Health at the University of Geneva are using to portray the experiences of those affected by Noma relies on extensive archival research. The Fondation Sentinelle has provided the research team with access to their archive of records of Noma patients treated by Sentinelle care centers in Burkina Faso and Niger over the last 3 decades. The archive consists of over 1,500 socio-medical surveys. My colleagues have designed and tested a detailed and complex database that includes general information on the patient, the story of the disease, so the age when acute Noma appeared, when it was first diagnosed, the type of lesion, first signs, symptoms, and so on. Information on patient care, information on healthcare access, including the distance to the near healthcare center, hospital, information on the family composition, on nutrition, hygiene, family income, housing, the level of education, access to work before and after Noma surgery, the impact of Noma on the child's life, How did they experience the disease? What were the consequences on a range of activities, as well as the impact on the family and the family dynamic? Now, some of the early findings confirm what other studies have previously hinted towards, but they confirm so with far greater detail and with a richness of information that we haven't had access to before. For example, in 2012, the UN Advisory Committee of the Human Rights Council study had found that Noma occasions some of the worst violations of the rights of the child and has specifically highlighted discrimination as an issue of major concern. Now, the preliminary results from the archival research confirmed that nearly 30% of children experience some form of discrimination, with 15.5% being rejected by their parents or peers. Moreover, 38.5% of parents have considered the disease to be a shame on the family, and 7.7% of families have been rejected by their village community. What this portrays is the important work of awareness raising that needs to occur to destigmatize Noma and to redress discrimination. New and refined findings are also extremely useful to understand where interventions should zoom in, where we should really focus. For example, early results suggest that 82.4% of parents of children with Noma do seek help during the first week of the disease. This is very early, and it's vital because of the fulminant progression of Noma. At the same time, our findings show that the families seek help from traditional healers. 72.4% have sought their help, and from the local integrated health centers, 67.1%. This suggests that it is vital that stakeholders train traditional healers and healthcare workers at local level to detect and treat early Noma, and also to enable them to refer more advanced cases of Noma to relevant healthcare facilities when available as soon as possible. The second pillar of research will also rely on other methods, such as extensive field work in case study countries, consisting of interviews with Noma survivors and their families. We would have hoped to be much farther advanced with these interviews. However, COVID-19 happened. We will also develop a socio-economic cost estimation of Noma, providing information about the cost of access to healthcare, the costs relating not just to treatment, but also things such as nutrition. And we have undertaken a legal doctrinal analysis pinpointing the rights of those at risk and surviving Noma, and the obligations of states and other stakeholders in relation to those rights. Coming to our third research pillar, this concerns Noma's framing. Frames are communicative methods that define problems, diagnose causes, and make moral judgments, while also suggesting remedies. They are used to foster support and to motivate action on a specific agenda. Framing theory provides us with insights into what manner of framing may most effectively address the prevention, detection, and treatment of Noma and realization of survivors' rights. Two main frames have been used in the context of Noma by medical professionals, non-governmental organizations, and human rights bodies. The first one refers to framing Noma as a neglected tropical disease, and the second one is a frame of Noma as a human rights concern. Coming to Noma as a neglected tropical disease. This was put forward by actors in the medical community and some, yet few, in the human rights community, including several of the members on our projects research team and our project partners, MSF, Sentinel, Hilfsaktion Noma, Winds of Hope, the NoNoma Federation. The reason why they have done that is because studies strongly indicate that the formal recognition of Noma as a World Health Organization neglected tropical disease could have positive implications for Noma in terms of research, treatment, and prevention. It could also, according to one scholar, and I'm citing, transfer Noma from the purely medical field into the political domain, therefore attracting attention of policymakers and donors, and therefore eliciting action on Noma. However, whilst NTD framing of Noma has been persuasively applied in theory, at least that's my view, it is yet to be realized in practice. We have undertaken as part of our project key informant interviews, trying to understand why the framing has not yet achieved its goal. And the suggested answers are a combination of the scattered and perhaps outdated data on epidemiology, insufficient strategic advocacy on Noma, insufficient buy-in from affected states and donors, and or a competition among entities and resources, which is the reality of today's world. However, we also see hope from our interviews and based on 3 very recent events. The first event concerns the recognition of Noma as an NTD by PLOS. And my colleagues, Leila Sroor and Denise Barati-Meyer, have been instrumental in arguing for this recognition. The second important occurrence is the language used in the WHO Afro step-by-step guide that I previously mentioned, which on my reading acknowledges Noma as a neglected tropical disease. And the third event that I wish to highlight is this very conference, through which MSF, in partnership with the International Society for Neglected Tropical Diseases, with Winds of Hope and the International NoNoma Federation and INEDIZ, aim to build a coalition allowing us to join our efforts towards including Noma in the WHO list of neglected tropical diseases. So I'm coming then to the last part of my presentation, the second framing, that of Noma as a human rights concern. The 2012 study of the Human Rights Council Advisory Committee on Severe Malnutrition and Childhood Diseases with Children Affected by Noma as an example. These UN studies have very long titles. So this study was the first iteration of Noma's framing from a human rights perspective. It identified the human rights of individuals at risk of or with Noma that are at stake. And this include the right to food, to water and sanitation, to health, to housing, to education, to life, freedom of expression, the right of children with disabilities to a full and decent life, and the right to equality and non-discrimination. The study also aimed to pinpoint some of the state's obligations that arise in the context of this disease, including by drawing up guidelines for a human rights-based approach to Noma. Interestingly, one of the recommendations of the study and the guidelines was that Noma should be included in the WHO list of neglected tropical diseases. Findings from key informant interviews that we have conducted suggest that the 2 framings of Noma as an NTD and Noma as a human rights issue are largely compatible. And what we are now exploring is an interesting subframing that portrays prevention and treatment of Noma, so the focus of states on individuals at risk and with Noma, as progress towards their realization of their obligations relating to human rights. Finally, I would like at the end of my talk to thank the research team of this project for their dedication in hard times, to thank our partners and funders for their support and their work, and to thank everyone involved in this conference and with an interest in Noma for their perseverance. Thank you.